Hi everybody, welcome back to the channel. I want to do this video today about healthcare abroad, specifically here in Thailand, which is where I am. I want to speak to people basically my age, in the 50s on up, who may be thinking, well, I want to travel abroad, I want to move to a foreign country, but I'm worried about healthcare, the cost, can I get insurance, how easy is it to get my prescriptions filled? The fear that you live in that ties you to your home country and your home procedure and process of, okay, I feel comfortable here, even though I might be paying a high monthly premium for insurance and my drugs may be very expensive. We kind of use that as a crutch not to go out and do things, especially travel abroad. So I want to share some of my experiences today. That this is my second year in Thailand. Last year I spent over 8 months here. I've been here about 3.5 weeks already. I plan on being here until April this year. So I too had those same worries and concerns. Oh my God, healthcare, I'm getting older, what if, right? And by keeping these doubts in my mind, I was not living my life. I was sitting there at home in fear, and I was what ifing myself and using that as an excuse not to travel, because as you get older in age and your health starts breaking down, you need to travel before you get where you can't. So I finally retired, and I got to that point where I had to make the decision: do I travel or do I stay in the States and what if myself, sitting here doubting everything and basically being miserable. So I decided to do some research and do what I wanted to do, and that was travel. So I came to Thailand, and before I tell you about that, let me just tell you a little bit about my health. I've had 4 heart surgeries. I've got 3 implants. I am on daily medication. My heart's not in the best shape in the world, but it's not bad. And I was always tied to the what if, or what if something happens, if I have a heart issue or a heart procedure. So I finally at some point had to make a decision. Am I going to let this kind of run my life and tie me to the States? And to be quite honest, healthcare got so expensive in the States that really going to get a heart procedure done or seeing a doctor, even with insurance, is costly, right? Because they don't pay 100%. You're going to have deductibles, copay, medicines, and stuff like that. So I decided to put that behind me, stay as healthy as I could, and travel. So the first thing my fear was when I got over here was the cost of my prescription meds. I loaded up for a 90-day supply. I came over. When my 90-day supply got to the end, I went to a pharmacy, walked into the pharmacy, said, do you have this statin that I take? Yes, we do. How much is 30-day supply? 30-day supply was $9. That's cheaper than most people's copayment on their drugs, to be quite honest. And not to mention you're paying a insurance premium just so you've got that coverage, and then you most likely have to go to a doctor and pay for a doctor's visit copay to get the prescription to go to get the medication, right? So you just walk into a pharmacy here, tell them what you need, and if they have it, they'll fill it for you and give you your options as far as price. So I paid $9 for a 30-day supply. So that kind of set my mind at ease there. So every time I got near the end of my 30-day supply, I would go before it ran out, and I'd get another 30-day supply. So that took that worry out. I take a 1-a-day low-dose aspirin. Those are plentiful here. They're cheap. I was also at the time taking a blood pressure medication as a preventative measure for my heart to slow it down and keep the heart rate down. And I was kind of concerned about that, if that was available. That too was available, and it was very cheap, within the same $9 to $12 for a 30-day supply. And all the medications are eitherwise, you can get Thai medications made here in Thailand. You can get the ones imported from Germany, Japan. Obviously the ones imported will be a little bit more expensive, but I bought the Thailand meds and I did fine on it. So I took that worry away. You walk into a pharmacy, you tell them what you want. Same thing in Vietnam. I noticed that in Vietnam, you go in there, you tell them what you want or what your symptoms are, and the pharmacist there can actually prescribe things for you. Same as here in Thailand. I had a heat rash once when I first got here because I wasn't used to the humid jungle type heat. I walked into a pharmacy, explained my situation, and she prescribed me something which would be equivalent to some hydrocortisone cream that you would get prescription back in the States. Just a few bucks, very cheap. So that took a lot of ease off my mind. So this time when I came back, I stayed in the States. I went back, let me go back a little bit. I went back to the States in April, and I stayed from April till September when I came back over. And during that time, I went to my doctor's visits, got my blood drawn, got my prescriptions refilled. And normally I get a skin cancer screening every year. This year, time ran out. I didn't get a chance to do that. I got my eyes examined. I got a new pair of glasses. I got all that while I was in the States, which all that's available here as well. So I called my dermatologist in the States, and I always did out of pocket with my dermatologist because the VA insurance that I have back home, you have to get referrals. Referrals take times, and then you have to get an appointment. Appointment takes times. So sometimes it could be 4 months before you can see a specialist, depending on what your situation is with the VA insurance that I have. So I kind of ran out of time with my screenings. But anyway, I called my dermatologist. I said, how much to see me? In the past, it had been, back in the States, in the past it had been $100 for the doctor's visit at the dermatologist's office. And, if they spray the nitrogen to freeze something off, that was anywhere from $40 to $60 per treatment per application, if I remember correctly. So this time before I left the States, I called again, was going to get that done, and they said, no, now the appointment's $200 just for the appointment. That's not counting any procedure they have to do as far as freezing something off, biopsies, anything like that. So I said, well, I'll wait till I get to Thailand and I'll do it. So just a few days ago, I was walking around, putting my glasses on. I felt a little bump behind my ear, and I kind of got concerned. So I said, well, now's a good time to go ahead and get my skincare screening. So my condo is right next door to Bangkok Hospital. I walked about 150 meters. I walked in. I said, I'd like to make an appointment with a dermatologist because that's where all the doctor's offices are here in hospitals. They're not in strip malls and plazas and stuff like that. So the lady spoke really good English, and she said, okay, we can see you at 14:30, which is 2:30. It was about 9:30 in the morning. She gave me an appointment slip, told me where to go when I came in, walk up to the 3rd floor. She showed me where the elevator was, spoke really good English, and she said they'll take care of you from there. So to back up a little bit, you got basically 3 options here. You got the private hospital, which is what I chose to go to. You've got the government hospital, and then you've got clinics. So the clinic I didn't think was a good option for me because they may not have a specialist. You may just got a general health care provider. And I wanted to make sure I had a licensed dermatologist since I have had some carcinomas and stuff like that. The government hospital, my girlfriend who's Thai told me, she said, well, the government hospital is cheaper, but there may be a communication problem because they don't speak good English, and you'll probably have to wait a little bit longer because that's the hospital that the Thais use. So I decided to go with the private hospital. So I said, well, can you give me an estimate on what how much the visit will be? She said the doctor will spend 1 hour with you, and I kind of, my eyes, an hour in the States, you do good if the doctor spends 10 minutes with you. And she said it'd be between 4,000 to 5,500 baht, which is anywhere from $110 to $160, $120 to $160. And I said, okay, well, I want to get this thing looked at on my ear just to make sure, and I need a screening. So I took the appointment at 14:30. So I came back to the condo, did some things around here, ate, and when it got time to my appointment, I walked to the elevator, went up to the third floor, and I looked for the signs. I followed the signs, all in good English. They call the dermatology department here the skin department. So I went to the skin department and gave her my slip, and she said, sit down. I was a few minutes early. And sure enough, at 14:30, 2:30 exactly, the nurse took me back. They took my vitals, blood pressure, and she said, strip down to your skivvies and, get on the bed here and, cover up. The doctor spent an hour. So this kept blowing my mind. Is the doctor's going to spend an hour with me? So I said, okay. So the nurse left. A few minutes later, knock on the door. It was the doctor, a young Thai doctor, probably in his early 30s. Spoke very good English, and he asked a little bit about my history, and I told him I'd had some carcinomas and some other things, and I'd get an appointment annually, and I decided to do it this year in Thailand. So he said, okay. So he had this little looking glass thing like a jeweler would use, and it had lights around it. And I was laying on my back, and I swear he looked at every mole, bump, blemish, lesion, everything from head to toe. He looked at it with that. And if he had questions, he would ask questions. And then he told me to flip over. He did the same thing. And as time went by, I'm thinking, man, he's spending a lot of time with me. And he kept, looking at, asked me, has this grown? Is this bigger? Have you noticed this in the past? And, asking good questions in English that, a dermatologist in the States would ask. So there was some places that he needed to freeze off with the cryo nitrogen stuff where they spray it on there. You can probably see some of the places on my face, where he got. And overall, there was probably about 10 or 12 places over my body, and even the place on the back of my ear, which he said he thought was just, some sort of age growth. He didn't think it was no cancerous or anything like that, which is good. It's kind of why I went there to begin with. He froze some spots on my face, froze some spots on my hand, my arms, I don't know, maybe 10 or 12 places. And I got to thinking about it back in the States. Each one of those freezing treatments would have been X amount of dollars per treatment, plus the $200 just for the doctor's visit. So when we finished, he asked me if I have any questions. I said no, and he gave me some suggestions about wearing sunscreen at my age and this and that and all the things that dermatologists tell you. And I said okay, and I appreciate it. And I told him, what my concerns were, and he answered them. So when I looked at the clock, he'd actually spent about 1 hour and 10 minutes with me, just me and him. There was no laptop in the room. No, he was not recording anything digitally. It was just me and him doing his examination. So the nurse came back in when he was finished. She said, put on your clothes and go sit out in the waiting room. So I did that. I went and sat in the waiting room. And the lady behind the desk, she printed out this long, actually 3 papers. Ones are, once I paid at the cashier, they printed me out a receipt. But they also printed me out all this stuff that he did, what the cost was for it, and his recommendations. And I'll try to flip over. And at the back, he recommended some things, some medications that I might go get over the counter and things like that. So when I went to the cashier and paid, it wound up to be 5,500 baht, and I paid with my credit card, and it wound up being almost 170 bucks, right? So they gave me a receipt, and they gave me also a paid receipt. So if I needed to file any claims with my insurance, which I've got travel insurance, but I don't think it's going to pay for a skin cancer treatment, so I'm not going to bother with that. So when I looked through all the paperwork, it was pretty detailed. So evidently he went back when he finished with me and sat in his office and put some stuff in the computer that the receptionist lady could print out and give to me at the end. So all in all, the hospital was very clean. The technology looked just as up to date and modern as the technology in the States. So I was very happy and very satisfied. Could I have saved a few bucks by going to the government hospital? Probably. But I didn't want to have the issue with communication to be a problem. My girlfriend couldn't go with me because she had to work. So I didn't want to have to get in the communication problem. So I just went 150 meters next door from my condo, Bangkok Hospital. Good English, no communication issues. Very, very happy with what I paid. And if you get one of these once a year, and let's say on average you pay that, or I pay that, that's just a little over $1 a day. And people say, oh my God, that's a lot to pay at the doctor. Well, when you consider if you're back in the States and you have to pay your monthly insurance premium plus your copay, your deductible and all that, really it's cheaper paying out of pocket here. Now, if I had some sort of big procedure, it could be, devastating financially, but either way, it would still be less expensive here than it would be in the States. Can you get medical insurance here? Yes. At my age, I've checked into this to the T. At my age, with pre-existing conditions, just to get inpatient, not outpatient, just to get inpatient, and they're not going to cover any pre-existing conditions, and they're only going to cover a percentage of what's covered that's not tied to pre-existing conditions, it's really not worth the money for me, because I looked into it. And for what I'd have to pay for as little as I would use it in the case that I might have some sort of a fatal or catastrophic or major issue happened medically, to me it wasn't working for it. So I decided to self-insure. So if something bad happened, I would just plop down my American Express Platinum card and say, put it on that. Hopefully it don't ever come to that. But if it did, then I'm self-insured and I'm covered. I've been through the system. I know how the system works. I'm happy with the system. Bangkok Hospital is a lot of places in Thailand. So if you're in your 50s, 60s, 70s, even in your 80s, and you're concerned about coming abroad to travel because of the health care you're tied to in your country, be it the United States, the UK, Australia, wherever, don't let that keep you from traveling, okay? Because, this isn't just some backwoods, undeveloped third world country. A lot of these doctors are trained in Australia, they're trained in Germany, Japan, the US. They get their training, from really good reputable places. And to me, healthcare has gotten in the States, and where I live, where it's not really as good as it used to be. And I don't have the confidence in it, because when you go to a doctor back in the States, you're going to see a nurse's assistant, a nurse practitioner, you're going to see some people like that. So it's going to be hard to see a doctor, and if you do see a doctor, you've got to wait a long time for an appointment. Here you just walk in, you get an appointment same day, sometime within the hour, depending on what you're there for. I did do some investigation on things like colonoscopy. If you paid out of pocket for a colonoscopy, it'd be somewhere between $500 to $650. And if you only get a colonoscopy once every 10 years, like most people, that's nothing per day. If you put a 50 cents, $1 a day in a jar, over 5-10 years, that's going to add up. And like for me, for my skin cancer screening, $160 over 365 days, that's just a little over $1 something a day that I will pay. Maybe that's one beer here that I don't have a day or something. Not that I drink every day, but I'm just saying as a reference point. You could put that money away somewhere, $1.50 a day, and then go pay for your out-of-pocket expenses. Now, if you have chronic conditions, diabetes, stuff like that, it's going to be different. It might be different for everybody. This is just my situation that I'm sharing with you. For the ladies, my girlfriend has Thai health insurance where she can use the government facilities, but for some reason the mammogram that she wanted to get done wasn't covered under the insurance, so she had to pay out of pocket. She wound up paying just about $98 out of pocket for a full scale mammogram. Ever what those are or detailed, I don't know. I have no clue, obviously. But to me, that sounded cheap for a mammogram to pay out of pocket. Maybe not for the Thais, but for us from the Western world, it would be what I consider cheap. So the whole point of this video is don't live in fear of, oh my God, I'm afraid to travel, I'm afraid to go see this place and that place because what if I get sick, what if I can't get this medication? Don't live your life that way. That's fear. Fear is controlling you and you're not enjoying life. So I just want to share a few of my experiences with you. There's been times where I've gotten sick from eating something, where I had an upset stomach. You just go in the pharmacy and tell them what's going on, and they'll prescribe you something or otherwise recommend something over the counter, depending on the severity of it. So the availability is good. The cost is good. The quality of the drugs and the treatments and the service and the providers, I think, is good. So I'm very happy with my experience at Bangkok Hospital. I don't know if you've had any other experiences. Please comment down below if you have, but good or bad or indifferent. But my whole point is don't let the fear of, oh my God, what if I can't get this medication? What if I get sick? What if? What if is fear. Fear controls you, and fear will not allow you to do things you want to do. And for me, when I retired, knowing I had a bad heart, I wanted to travel, places I wanted to go, things I want to see. And I'm just not going to let the fear make me stay home in the States and stare at the walls and not do anything. So if you're thinking about living your life and you're worried about these issues with drugs, medicine, availability of health care, costs, things like that, which are all valid concerns, listen to other people, look at YouTube videos, make your own decision on how your health is and what you think are the best. This is just, I'm telling you what happened to me, and luckily it wasn't anything serious. but even if it was, I would feel comfortable getting it handled here. So don't let fear rule you is the whole thing I'm trying to say with this video. So I just wanted to share my experience with you about Bangkok Hospital, about the healthcare, about the drugs, things of that nature. Please like, subscribe, and share my channel. I'm going to be doing a lot more other travel videos, but I did want to share this experience with you from Bangkok Hospital. Just under 170 bucks. Spent over an hour and 10 minutes with a doctor, licensed medical dermatologist doctor. Just me and him in the room together. No nurse, no laptop, no nothing. And he was concentrated, focused 100% on me and every part of my body that he needed to look at with his apparatus, because he wanted to make sure I had a detailed skincare screening. And I'm happy he did, and I'm very happy with it and very satisfied. So anyway, that being said, like, subscribe, and share. Please follow my channel. Got a lot more good things coming up, a lot of good places. You've been seeing some videos with me and my Thai girlfriend. We'll be talking about some things. I hope you've enjoyed this. Please like, subscribe, and share as I'm trying to grow the channel. Peace out from Thailand. See you later.